so much to the organizers and all of you for being here. This has been a fascinating meeting. I really enjoyed it and learned a lot. Is this a pointer by any chance? Yes. Okay, well, let me make sure I understand it. The pointer part is just this?
The middle button, yeah.
Sure. You see anything?
Yep, there it is.
You do? Oh, gosh, where? Let's see.
This little
Oh,
right
this
there.
little thing? Oh, God. Can you see it? Okay. Well, good. Okay. So I am going to talk about the issue of environmental exposures in utero and also cumulative ongoing exposures over the early months and years of life, and give you in a nutshell what we're trying to do at our Columbia Center for Children's Environmental Health. This is one of now, I think it's 12 such centers funded jointly by NIEHS and EPA. Ours was among the very first funded, and these are like beads in a necklace across the country. And we began the first, I think it was the first and most comprehensive birth cohort study on environment and health of children, starting with pregnant mothers being enrolled. And there are other centers that have done the same in different populations, in different geographic areas. And cumulatively, we have really shed quite a great deal of light on this issue of vulnerability of the fetus and young child, and have worked to translate this information to prevention. So I don't think our center's materials were given to you, but I'll make sure they're available, like our tip sheets and fact sheets and things like that that have been developed. And a lot of that translation work is jointly with our community partners, especially West Harlem Environmental Action and others, to make sure that our communication makes sense to people in the community. Also that we get the word to policymakers who are mandated to act when we have when we identify environmental risks to children. So, in our center, we're doing parallel studies, cohort studies. The largest is in New York, and we also enrolled a second one after 9/11. And then we have parallel studies in Europe, in Krakow, and in China. Both of those places were selected because of a lot of coal burning as well as traffic and other pollution, and were selected to parallel and use the same approach, molecular epidemiology, I'll explain what that is, and look at multiple outcomes: neurodevelopment, asthma, obesity, metabolic disorders, cancer risk. And here are some of the children and a mother in our different studies. And you're very familiar with sources of outdoor pollution. Many of them are from fossil fuel combustion, as we know. And this is a source both of toxic emissions, toxic pollutants that affect children's health, and also, of course, they're a major source of climate change by generating CO2, the major climate-altering gas. And they're very familiar to us in the urban setting. Diesel is a particularly rich source. Now, indoor sources include smoking and secondhand smoke exposure, pesticides, burning of fuel for cooking, heating, and then these adorable little so-called rubber duckies, phthalates, containing phthalates, and bottles and other food containers containing bisphenol A. But what's often forgotten is that there's ready and easy penetration of outdoor pollutants into the indoor environment, so that involuntary exposure becomes an indoor environment that we experience outdoors, is also an important indoor environmental exposure. So we're dealing with multiple exposures all occurring at the same time. And so I've listed a few that, well, not all of them that we are studying, but most of them that we are studying in the center. And they are first and foremost, in terms of my talk, polycyclic aromatic hydrocarbons, which sound great, aromatic, what could be wrong with that? But as we know, these are very toxic combustion byproducts. And then we are all, equally importantly, we are studying the endocrine disruptors. PAH is an endocrine disruptor as well. I'll convince you of that, I think, in a minute. Bisphenol A phthalates, the pesticides, both the organophosphates and the pyrethroids that were brought in to replace them that seem also to be neurotoxic. And the flame retardants like PBDEs and metals. And of course, now, so this is complex, many exposures co-occurring, and then multiple effects from the same exposure. So, many of these cause neurobehavioral development, adverse birth outcomes, obesity, metabolic disorders, asthma, and airway inflammation. And we have some evidence about increased risk of cancer looking at chromosomal changes in newborns. So it is a complex picture, rather daunting. And to make it even more exciting, we and others are looking at whether epigenetic alterations are in part mediating the effects of these environmental exposures. Why? Because we want to understand the mechanisms. We want to understand the differential susceptibility of the very young fetal window as well as early childhood, and be sure that we target our interventions accordingly. So we are looking at that mechanism as well as others. Well, we should be aware, and I think you are all aware, that there is disproportionate exposure and risk. Certain populations and subgroups get hit harder. And that's because there's more sighting of toxic exposures, not only of PAH, but of other sources of pollution in lower income communities of color. There's quite a growing literature on that, large and growing literature. And these communities also experience more material hardship and psychosocial stressors. And I would add less access to good food sources, healthy food. And we know that these factors, both socioeconomic stressors, and physical pollutants, can interact to increase risk of neurodevelopmental and other disorders. Lead, traffic-related pollutants, environmental tobacco smoke, that's been seen, and I'll show you some examples. And they can act through common pathways, inflammation, for example, and immune pathways. And we do need to understand these interactions to intervene effectively and protect those at greatest risk. So we've seen this slide in many forms, the susceptibility of the fetus and child, all the reasons shown here, we've discussed them. Not only greater vulnerability to the physical toxicants, but also to the psychosocial stressors experienced by the mother. And so there's a window there that we have to be particularly, as you are, of course, working to protect. And there's been a lot of discussion about the difference in the expression of the so-called good detoxifying genes, like glutathinous transferases, and the metabolically activating genes. They work very differently in the fetus than in the adult, even when the genotypes are identical. So I don't need to dwell on this slide. I will go forward to give you this example of PAH. Now, you may think, well, why PAH? It's an involuntary exposure. But actually, there are many indoor sources: incense burning, candle burning, cooking, lack of proper ventilation, and also the penetration, of course, outdoor emissions is involuntary. But there are many things that individuals can do to protect the home and clean the home environment and reduce those exposures, including air filters, and including getting active in community efforts to get clean air policies. And they've been very effective, for example, in Harlem, preventing more sighting of diesel bus depots, arguing for replacing dirty diesel buses with clean air technology. When you're in New York, you'll see big signs on a bus, I use a clean air technology. Well, when I started my research and stood behind a bus, I was enveloped in a huge black cloud from the tailpipe. And there are also policies to reduce traffic congestion and idling of trucks, buses. So I'll show you some data from our cohort study showing that these seem to have worked, at least we've got lots more to do, but the levels have come down over time. Well, anyway, it's a model compound, endocrine disruptor, as well as a genotoxic agent, and shows the principle of multiple effects and continuing effects over the life of the child related to early exposures. So the backdrop is the growing burden of neurodevelopmental disorders in children in the U.S. At this time, I think, well, this was a few years ago, 12% of kids in the U.S. have at least one neurodevelopmental disorder, such as ADHD or a learning or intellectual disability. And the rates of these conditions have increased, some due to better diagnosis, but apart from that, the rates have increased, and disproportionately high rates in underserved communities. So I think I already covered this slide pretty much, but I want to emphasize that PAH are linked to many different kinds of toxicity. And we and others have shown neurodevelopmental toxicity, asthma, immunotoxicity, carcinogenicity, and obesity, all related to PAH. But I didn't want to drown you and show you all of this work. And besides, we'd be here for a very long time and miss lunch. So I'm going to focus on the neurodevelopment. They are endocrine disruptors, as I said. The PAH, like BAP, benzpyrene, a sort of classic representative PAH, resembles steroid hormones, and they do induce estrogen-dependent cell proliferation and affect gene expression in those hormonal regulatory pathways, such as the AH receptor and the different enzyme pathways through CYP1A1, CYP1B1, etc. Well, here's a mother and a research worker in our cohort in New York City, which was begun actually through a small R01 that I had, and then we got the Center grant and were able to expand it in 1998. So this is a long-term study, and this child is now 14, 15. They're all becoming adolescents. We're going to have quite a few adolescents, and it's wonderful. And there's a very close bond between the research workers and the children. So we enrolled 720 pairs of mothers and children, and they live in northern Manhattan and the South Bronx. Do you see use this pointer, although it's so tiny. I can't see it, but maybe, anyway. The GW Bridge is that line going across the Hudson River on the left, and those dots are where the women live. They were purposely, we enrolled non-smoking mothers, not actively smoking mothers, because we didn't want to swamp out our exposures with this very well-known risk factor. And they're African American and Dominican, because these are the main populations in the communities we serve. Recruited during pregnancy, personal air monitoring was conducted, and then the different biospecimens are collected at birth. And then from the children, starting with at age 2 years, urine and a small sample of blood. And we're following the children through adolescence. We hope to be able to continue to follow the cohort, hopefully further. But I should mention, maybe I'll mention my sob story here later, that these different centers with cohorts are endangered by some of by the budget cuts, by the delays in funding, and there was great concern because you can't just call up your cohort members and say, we've run out of funds, we don't have enough funds to continue, but we'll call you. You lose them, and you lose your very highly trained and motivated research staff. So this is a time of some anxiety, and many of us are waiting for just the announcement that we will have an opportunity to renew our centers, who were the first funded, and therefore we're in our last year of funding. So it's a kind of nerve-wracking time. In any case, we hope and plan to be able to follow this cohort through adolescence. And geographic information system methods are being used to map the women where they live with it when the child was in utero, after any moves, and the levels of neighborhood levels of pollution and other social and economic factors. So this GIS is an important aspect. So what we do in our center is, of course, large term molecular epidemiology. It's an approach that we and colleagues pioneered way back in the 1970s, 80s, where we incorporate more traditional methods of assessing exposure, questionnaires and monitoring, and now we add GIS, and clinical outcomes on the right, with biomarkers, many different biomarkers that give us an internal dosimeter or a biologically effective dose measure for the different contaminants we're interested in. So the adducts formed by PAH, when they enter the body, metabolically activated and latch on to DNA. This is a kind of fingerprint of exposure, good for the kind of forensic work we do. We measure the metabolites of PAH in urine, pesticides, the BPA phthalates, flame retardants, and you can look down, and then you see the chromosomal aberrations and immune changes that we study. So these are more in the realm of a preclinical response marker, more related to risk and to the outcomes. We are studying DNA methylation, and then we look at genetic polymorphisms and micronutrients in the diet using biomarkers. So they're a kind of a connector, linchpin between our exposures and outcomes, complementing the monitoring that we do. And then I showed the multiple outcomes that are clinically assessed in the children. And these are done repeatedly over time. So you can see this is very labor-intensive work, requires a very devoted and highly trained staff. Well, for PAH, we measure it in a number of ways through this prenatal questionnaire about secondhand smoke exposure, ventilation in the home, cooking, dietary exposure to grilled food, so forth. Area residential monitoring data are used, GIS, and then a small backpack monitor is used to find out about the personal exposure in the breathing of a PAH in the breathing zone of the woman over a period of time during pregnancy. So this is a snapshot during the 3rd trimester of pregnancy. And then the urinary PAH metabolites in pregnancy and then later in the children, and biologically effective dose through the adducts. This little black blob is benzpyrene nestled into the double helix, looking very benign, but it can lead to other to damage and to increased risk. So what did we find about exposure using these methods? Well, all the women were exposed to PAH in air, and there was huge variability, several orders of magnitude, from 0.36 nanograms per cubic meter to 36 nanograms per cubic meter, allowing us, this variability allows us to look at to do our analysis of relationships with the outcomes. And 40% of the cord blood and maternal blood had detectable levels of DNA adducts, and all the mothers and all the children have detectable levels of multiple PAH metabolites. And basically all of the kids had, well, I mentioned that. To assess the cognitive behavioral problems, we use a number of methods. I mentioned the monitoring, the adducts. We look at the development of children at ages 1, 2, 3 with the Bailey scales, the WIPSI, the Wechsler preschool intelligence test, and then the test that's WISC that is given later for IQ, which both the WIPSI and WISC give you an IQ, the WISC for the older children. And then the child behavior checklist and Connor scale when we're interested in ADHD. The child behavior checklist will give you information on a wider range of behaviors. And scores are computed for each syndrome of a priori interest. And now we've broadened to those that were not of a priori interest based on experiments in laboratory animals, such as anxious, depressed, attention problems. So we've gone further. And so I'll report some of those findings. So at age 3, we found that high prenatal PAH exposure to PAH, redundant, was associated with lower mental development index score at age 3. And the odds were about 3 times greater among those children of having a developmental delay at age 3 were about 2 times greater than the odds among unexposed kids. And people say, well, wait, there are so many other factors. Have you taken account of those? What about the pesticide, chlorpyrifos, that you've been studying and reporting on? And what about secondhand smoke? And what about stressors due to socioeconomic factors? So in our analyses, we do adjust and take those into account. So our list of covariates is fairly long, and of course we can't do this perfectly, but we sure try, and we use our different methods of assessing those cofactors. Looking further, so the children are getting older, and so are we. And we see that prenatal PAH, also using the backpack monitoring measure, is associated with reduced IQ at age 5 in the cohort. Full scale and verbal IQ scores, those associations are significant. Full scale on the left, verbal in the middle. Performance IQ, a trend but not significant. And also accounting for the covariates such as I listed at the bottom. And they necessarily include IQ of the mom and the quality of the home environment, the home nurturing environment, the physical caretaking environment. So we have developmental outcome at age 3, at age 5, reduced IQ, and these decrements that we see are similar to what is seen with low-level lead. And that was, I would say, alarming, to say the least. And so a significant effect in term overall, on average, for those children who are more highly exposed. Well, this is a really busy slide, and I think if you just look at the highlighted, the p-value, I've highlighted the significant p-values, but here we looked, again, backpack monitor, but we also, in additional analyses, we looked at the PAH DNA adduct measure, that fingerprint of exposure, in maternal blood taken at delivery, and in the cord blood, the umbilical cord blood. And we looked to see whether, and just to give a moment of background, there had been some experiments in laboratory animals showing that there was evidence of greater anxiety, depression, attentional problems, problems with learning and memory in the experimental animals who were more highly exposed. And so those were of a priori interest to us. And using this child behavior checklist, we saw that high PAH exposure, backpack monitoring, was associated with these, symptoms of anxiety and depression, also attention problems, as were both measures of DNA adducts. And the diagnostic oriented scales, anxiety problems were associated with PAH, and the trend was there for the other measures. So they're fairly consistent for these particular outcomes. And this was at age 6 to 8, so you see we're traveling along with the kids, keeping up with them. And I had mentioned epigenetic alterations as a possible mediating mechanism. And as we all know, this period of post-fertilization and before implantation and around implantation is very important in the epigenetic programming, as methylation marks are first erased in the non-imprinted genes and then reestablished. And there's evidence that the marks and the programming that is effectuated at that time remains quite stable over the future years, surprisingly so. And so this could be a period of sensitivity to any agent that could disrupt this normal sort of epigenetic choreography. That is really a poet's version of a very complex subject. But just want to end a few slides on, we have the opportunity with the data set we have to look at whether epigenetic mechanisms mediate other exposure outcome associations that we're studying in the cohort, because the cohort center investigators have reported adverse effects of phthalates, bisphenol A, pyrethroids, substitutes for the organophosphate, and chlorpyrifos organophosphate insecticide on neurodevelopment, and also with childhood phthalates and BPA with childhood eczema, airway inflammation, and/or asthma. And chlorpyrifos has been associated with lower birth weight, developmental deficits, ADHD, decreased IQ, and brain anomalies. So we have all these other exposure outcome associations, and it will be interesting to see whether these same mechanisms mediate those exposures, and quite a challenge looking at effects of combined exposures and mixtures. This is a huge challenge in our field. Well, to cheer you all up, because you're looking pretty depressed, there's some good news in that policies can work, and EPA did phase out, really the term is phase out, the residential use of chlorpyrifos, and that took effect in 2001. And measuring chlorpyrifos in cord blood, working with CDC, as we do in many of our studies for the different exposures, you can see that by 2001, there was already, by the way, in 2000, those products were being discontinued and started to be pulled off the shelves. And then the levels dropped way down, and then became very low by 2003, negligible 2003, 2004. So this is sort of a record that a policy intervention, a regulation of a toxic pesticide had a direct benefit in children, and we could measure that and no longer saw the adverse. We're able to see significant adverse associations between exposure and the outcomes. And then in New York City, through the measures that I had mentioned of some of the city policies to reduce traffic emissions, for example, the exposures to PAH did decline as we measured them in backpacks, and that work is continued, and the trend is continuing through 2012 for these PAH, but I'm sorry to say for pyrene, which is also a PAH, but not one of the ones here, that's not so true, and we think that's from residential oil burning, so there's much more work to be done there. And we work very closely, and I can come back to that, with WEACT, who are wonderful at, arranging the center investigators and that they testify using our data and really bring this to bear in decision making. And by the way, Mayor Bloomberg wrote us a nice letter saying that our data on pesticides had prompted the first citywide bill on residential pesticide use limitation, and also prompted them to work on the emissions of traffic-related pollutants and other sources of air pollution, because they paid a lot of attention to the asthma work we were doing. And then in China, we did a study, an intervention that studying an intervention again by the government, where the government, and they can do this in China, just shut down the very dirty old coal plants. Can't seem to do much about that in the US, but in China, by a certain date, shut that down. And we had enrolled one cohort here, or we planned to enroll one before shutdown, and we did, and then 2 more after. So these, in theory, these babies had in utero exposure and some postnatal, and these did not. And we compared before and after in monitoring data, biomarker data, fetal child growth and development. And we did see benefits in terms of the cord adduct levels, which you see here on the left. They came down significantly between the first cohort and the second, and we're still working on the third cohort data. And then the air levels that we monitored, we set up monitoring stations, and those levels came down as well. Still a way to go. This is in Chongqing, China, but some direct benefits in terms of these measurable exposure, biomarker outcomes. And then in the second cohort, we no longer saw the significant associations between adducts and lower developmental scores using the Gazelle test. And so that was also a testimony of benefits. So to conclude, we've used our data working with our partners to design educational interventions in the community and beyond, and we've developed a Healthy Home, Healthy Child in Spanish and English newsletter and tip sheets, which we think are useful. They were focus grouped, and they've been worked on very hard, and they're graphically very exciting, pull people in. We learned that heavy text doesn't work, and I don't think we provided those materials to you, did we? So can we do that post-hoc? Okay. And then the work can be used as work, I'm talking about our center, but all the other centers also, to inform causal inference, risk assessment, policy reform, and to design interventions and monitor their efficacy. And I could give another talk on some of the interventions that we've designed and are monitoring or have reported on, and then efforts to see whether they're working over time. So in conclusion, our findings do indicate continuing effects of prenatal or cumulative exposure as the children progress in age and interactions with psychosocial stressors and the physical environmental contaminants. And some evidence, which I haven't shown you, that PAH may be operating in part through epigenetic mechanisms. And of course, we're very concerned about this on neurobehavior and behavioral problems, IQ and behavioral problems, because of the consequences on future quality and accomplishment of the children over their lifetime and their health. And as someone else, a number of speakers have mentioned, future generations as well. So the results indicate the need for reduction of neurotoxic exposures, and that's what I just said. And here is a team. This isn't even the full list, but you can see I'm talking about a lot of people's work here, and I don't have time to go through them, but it is really a huge effort, starting back in 1997. I can't believe it. And I thank all of those people and colleagues in the other, in the international studies, and of course our funders, and I have no conflicts, and thanks to the mothers and children. Thank you. So back to your question.
Well, you got to
Did
it.
I get to it?
To some extent. I think maybe I should have you published some on that? Yeah, you just search
Yes,
on
Peggy Shepard, who is the director of WEAT, and her colleagues actually took the lead on a paper describing this partnership and how effective it had been. And the Kellogg Foundation cited this partnership as an example of, such a good partnership. Well, I don't want to boast, but they did cite this as an example of an effective community academic partnership. And there are many others too. I'm not trying to hog the limelight here, but I was very proud to have that notice. Yes?
The work, the interactive findings between psychosocial stressors and environmental contaminants, really interesting. And I'm wondering if you're embarking on doing any mechanistic work to identify what are the overlapping biological pathways.
Yes. We want to do that, yes. And so we will have the data on methylation, which can be used to look at the effects. We can see whether the stressors are operating through that pathway. And it's going to be complicated looking at the interaction. I can see that. We're going to have to bring in some more experts on that sort of analysis. But that's very interesting because there's evidence. Bruce McEwen at Rockefeller has published a lot on the shared pathways, the inflammatory immune pathways. And I didn't run them, but I asked a laboratory at Columbia that's very practiced in this to look at their, using Luminex to look at the, just a small number of pilot samples at whether the exposures, the PAH in this case, exposures did affect cytokines and chemokines using their particular custom-designed microarray, and in fact there was some very interesting evidence. So that might be something we want to follow through on. We just need fun, we're going to all need funds to do this work, and it is urgent. Yes, 3 minutes, okay. Are there any other questions or comments? Yes.
I'm Jerry Paulson. So this may actually be a question more for the obstetricians and gynecologists in the audience, but one of the issues that was brought up in your talk and has come up in some of the other talks is the change in the placenta over time of the months of gestation. Mm-hmm. And what might be ways of looking at the change that occurs and then one woman to another, or group of women to others, to see if what the outcome is in the kids or the outcome related to the pregnancy is a placentally mediated process.
Well, I'm not quite sure how one would do that. Now, I want to go back because I think I messed up a little bit my answers to you. I was thinking out loud. I don't think there's any one mechanism. I think that what the fetus receives, activates on his or her own, or receives in an activated form, is important in terms of neuronal development and differentiation and so forth. So I'm not trying to say this, that the placenta might be the whole problem. I just think it may be an important contributor, and of course it may depend on the time frame. But these are chronic exposures. These are not one hit and then you're fine. You're living in this environment, and I think that's true for the other exposures that we're studying. I think BPA, you're getting it pretty chronically, and phthalates as well, because it's in the home environment. It's in the products. One uses consumer products in cooking and foods. So it will be difficult to tease out apart, but I'd love to know what you experts think about that. Is there a way to go back and target a particular moment in time?
Well, it's hard to sample the placenta across gestation age in any biologic sort of way.
Oh, you can do it.
Well, you can. We've done some pilot studies looking at changes in epigenetics from first trimester CDS specimens in the same placentas at third trimester of delivery. But it's very hard to sort of sample the placenta because of the amount that you're able to sample biologically during a Grant-Bill sampling or some other placental biopsy is very, very small.
Yes, and we do
it's hard
collect
to follow those
placental
patients'
samples. We do collect those at delivery, and we have them stored if anyone can figure out a way of doing that. And like, are there rings in the placenta like for trees? I'm just joking. Actually, I went yesterday. I heard a wonderful talk on the tooth, the child's shed tooth. It was like a tree. You can go back and look at from the moment they were in utero, and then birth, and then every month after that you can go back and see what they were exposed to.
The placenta has a lamellar structure, but that's an interesting thought. I'll have to think on that some more.
Yeah, well, we have the samples for you.
Carol and Sophia in New York at what's Carol and Sophia's placental omics or something like that? Yeah. So anyway, they've been doing some laser capture technology. So they take a flash frozen placenta, they cryo cut it, and then they do laser capture to get uniform types of cytotrophoblastic cells. So at least you're not, because the placenta continues to get remodeled through pregnancy. And so they've tried to use that, but the problem is you can really only use one cell, and it's a whole ecologic niche. And the reason the placenta changes is because it has to for metabolic support as the fetus goes from catabolic to anabolic state. So I think that gets to be a little bit problematic, but that's probably the best example out there of somebody who's at least tried to uniformly look at it.
Yeah. Well, okay. I had one last thought. I mean, these chemicals do cross the blood-brain barrier of the fetus. There's quite readily. So, I think, as I say, there are multiple mechanisms involved, and we're just at the beginning. Thank you so much.